the large majority of the audience that's on socials are not physicians. Even like if you have a podiatrist speaking podiatry talk to me, I don't know what they're talking about either. So essentially, when I'm talking at such a high level, I can probably only get out there to other spine surgeons or other really high level specialists. And so that's not really the audience that we're gauging to. So I think you need to learn your audience and who you're speaking to.
Welcome back to Wellness at the Speed of Light podcast. I'm your host, Dr. Stefano Sinacropi. On today's episode, we've got a very special guest, Dr. Betsy Grunch. Dr. Grunch is a board-certified neurosurgeon. She did her medical school at the Medical College of Georgia and then her residency at Duke Neurosurgery, one of the most prestigious neurosurgical programs in the country, and then stayed there for the Synthes Spine Fellowship. Since that time, she's been at the Longstreet Clinic in Georgia and has patients fly in from all over the country seeking her care and services. She has won all kinds of awards for her clinical excellence and is somebody who is very, very well known in the social media circles. Now, let me tell you a little bit about Dr. Grunch. Dr. Grunch has over 2 million followers on her social media channels. She is one of the most well-known physicians and social media influencers. And I came across her profile last year, immediately started following her, and really enjoyed both her entertaining content, but mostly her educational content, which was a masterclass in being able to take complex subjects and put them in a way that the lay public can really understand, as education is paramount in today's environment with so much misinformation, bombardment of information, and so many so-called influencers out there that are not really experts on these topics. So I was very excited to see somebody like Dr. Grunch giving so much non-biased, scientifically based information to help us all make decisions as to our care. On today's show, we're going to cover everything from her grueling training at Duke on to being a female neurosurgeon and some of the challenges with that. But I really want to dive into these questions, and those are the following. What do doctors and other experts need to do to become successful on social media in order to be able to get their messages out and help the global community to learn about the amazing things that are going on in the medical fields and make better informed decisions on their health? I really want to know how she got started in social media, how she became so big in social media, and all of her tips and advice for those of us that want to be out on social media, educating the public, making the world a better place. So I think it's going to be an amazing episode. Can't wait to dive into this one, and I hope you really enjoy it. Here's episode 10 with Dr. Betsy Grunch. Everyone, and welcome back to Wellness at the Speed of Light podcast. So excited today to really dive into it with Betsy Grunch, who is a very well-known neurosurgeon who's currently practicing in Georgia. She first got on my personal radar because I've been following her for quite some time now, and her content is nothing less than spectacular. So before we even start, I will tell everyone to go and follow her on all your favorite social media channels, because she is not only a great educator, but super entertaining. And you'll see what I mean if you follow her on her channels. So welcome, Dr. Grunch, to the show. So I'm going to just start really broadly. Tell us about how you even decided to go so hardcore into social media. What was the spark that made you say, you know what, I'm just going to get out there and just tell it like it is?
It wasn't like one day I woke up and I'm like, let's do this. It was, I mean, I've always been very much social media inclined. I love posting about my life, my family, my job, etc. But it was always kind of in this way that was just with my friends and family and whatnot on Facebook. And I had a professional Instagram page. Never really used TikTok or YouTube or any of those things. But one day I was posting. It was during the pandemic. I had this pandemic boredom, right? So we couldn't operate. We couldn't really do any type of surgery or anything like that. So me and my PA were sitting in clinic. We had like 3 patients that day, and we're like, you know what? Let's make a reel. So we got this, camera, set it up. We did this dance, and then I went home that night, and I'm like, I'm going to post a video about being a female surgeon. And I posted it on Instagram, and I went into TikTok to edit it. And I just put it out there, and I didn't realize that I was not private on TikTok. And it went viral. I mean, it viral for me at the time was like a couple 100,000 views, and I was a little shocked at just the response and the engagement. And I was inspired because so many people were like, "Oh, I've never seen a female spine surgeon. I want to be a neurosurgeon when I grow up." And it was just very powerful, the response I got. And I'm like, you know what? There are no other neurosurgeons in this realm, and there's certainly not any women surgeons that I've seen in my algorithm. So what I'm going to do is I'm going to post every day for 3 months, and I'm going to just see what happens. And so that's how it really, honestly, how it started. It's just kind of grown from there. That was in 2021. So
That's kind of how, it goes. I think for me, I mean, I had a professional page and I wasn't doing anything with it other than occasionally connecting with local people or something like that when I decided to go on there. And then one day it was talking so much, I tend to talk a lot. And somebody said, well, why aren't you out there more? Why aren't you giving all these little nuggets that you like to just bombard us all constantly with? And I just decided, to go out there and start doing it. And I found people like you that, have been inspiration to me. And, just really, you just got to do it on a consistent basis. And, we'll get into all, that in a little bit. I wanted to start with that because it is just such a unique thing to you that you've been able to develop such a big social media presence. And honestly, and your content is really good. And that's, one of the things we'll talk about later. If you put out really good educational content that lay people and medical professionals can both get something out of it, it's great. And that's what you've done. And it's been great. You have a tremendous following at this time. I want to talk a little bit about your background. I mean, you trained at Duke, and I remember when I was applying for schools and things like that, everyone said, "Oh my God, Duke is always the, if you go to Duke, 100% divorce rate, back in the day in the surgical programs, obviously famous thing." So one of the things I want folks to get out of this is how intense the training that you required to become a neurosurgeon and where you are now. So you certainly deserve all the accolades that you get. Can you talk about and tell our listeners how difficult it is to go through programs like you went through, especially as a female neurosurgeon, because it's different.
yeah.
I'd be the first. I know. I've seen wonderful women come through these very intense programs, including where I trained, and there are things that are unique to being a woman and being able to get through these, let's just call them fairly malignant program. It's just the way we make it. It's a hazing process. I get it. I have mixed feelings about it. But anyway, I'll
Yeah.
let you speak on kind of what your experience was in these very tough programs and being a woman coming through this.
Oh, I think it's just I think it's just kind of a note to what I do now as to kind of what I've been through. And you're right. I mean, I matched at Duke Neurosurgery, and it's such a great program. I would never do anything any differently, and I had a tremendous amount of support. But you're right. I mean, there are some programs that are more quote toxic than others, but let's be honest, every training program in the country. It doesn't matter if you're a neurosurgeon or a psychiatrist. I mean, it's tough. Medical training
Yes.
is meant to be tough, and you don't want your brain surgeon not knowing what toughness is, because when you're in that situation where someone's life is on the line, you need someone that can really step up and run the room. So, we can't be too light on our training, but I think there are ways. I won't go off on my whole deep end of how we can minimize the toxicity of our healthcare training. But yeah, I mean, it's a tough program. And at the time when I trained too, it was before the 80-hour work week. I don't know how I did it. I knew I'm a very passionate person, and I knew that it's just a few years of toughness, if you will, and I can get through it. So, I mean, there was times where I don't even know how I drove home at night, from being so exhausted from working 120 hours a week during my intern year, to just being told that I shouldn't be a surgeon by my people that are training me, and like I'm not good enough to be here. Is We've all been told that in healthcare, and it's really just so toxic sometimes. And but yeah, I think just getting through that training program and getting through residency in general as a healthcare professional is just a note to how tough physicians are and what we have to go through. And I don't think anybody really understands it unless you've been through it. And I mean, you get it, I get it, other people get it, but people in the public and even nurses or other healthcare professionals really just don't understand unless they are married to someone that's been through it, and it's tough.
Well, I mean, that's a great answer. You'll appreciate this. I was sitting with a neurosurgeon from another part of the country about a month ago, and he wouldn't want me to say who he is. He was talking about his particular neurosurgical program and kind of what he went through. He came out about when I came out. So this is like in the 2006, 2007 area. And the malignant nature of what he went through, the stories that he shared with me for an hour, I told him that is a best-selling book, what you're telling me. I mean, it is insane. And so I saw what the docs went through at Columbia Neurosurgery as I was there, as I was friends with a lot of those folks as I was doing my ortho surgery residency. But what they went through in that particular program, it was almost intolerable. I just, people don't have, exactly like you said, they just don't understand, kind of what it takes to get through. That's almost like a version of a Navy SEAL training where they
Yes.
put you in the water and they wait for you, right? You ring the bell. So if you can make it through,
Yeah.
if you can make it through and not ring that bell, it's good. All you have to do is say I'm out, and they're happy to let you go. So I think
I
that
had this,
it's
I'll share one story about my intern year that I've never shared on social media before, because I've contemplated whether or not I should. But
love it.
we sat down as interns, general surgery, because at the time neurosurgery wasn't a straight program. You did a general surgery internship, which general surgery at Duke, I think, is probably one of the, at least at the time, was probably one of the most toxic programs. But they set us down there. They gave us this pamphlet, and the name of the pamphlet was Swimming with Sharks. And we were in there with I don't even know how many, 20 new surgery interns, including ortho, urology, general, everybody was in there. And this older surgeon, and as he said, you guys, we're going to go through how you swim with sharks, because basically, if you bleed, or you will be
Uh,
eaten alive. So do not bleed. And basically, how we're little minnows swimming around, and you've got to get out of the way of the sharks, who are the attendings, essentially, or people that are training you, so you don't get eaten. And that was the gist of this introduction to general surgery. And I looked around and I'm like, I don't know what's happening right now. I don't know where I signed up to do, but here we go. And then on the same token, we were forced to wear short white coats and white pants as general surgery interns for an entire year. So we essentially look like nursing students as the general surgery residents in training. And I I tell this to other people are like, you guys had to wear white pants. Where do you buy white pants in the middle of winter? You can't find them. So, I mean, and the guys having to wear white pants, it's rough.
Yeah, the white pants thing on the guys, that's a whole that's a whole other discussion. You gotta, I mean, that's a different, you gotta pull that off a little different. Well, thanks for sharing. I mean, that's a great story. You know what? That sums it up. That's a great story. And I think you should get that out on social media, because I think these are the kinds of things that I feel like we don't share enough as physicians, and sharing this stuff with our patients, kind of our personal stories. They love it, and it does give us a glimpse. And then maybe, they are not, thinking that we're not human. We kind of suffer the same ailments and the same things. And certainly from a mental health standpoint, people have to really realize how difficult it is to get through these programs night after night, not sleeping. How many studies are there out there right now on how your brain is functioning on literally no sleep? And I was just like you, I was pre any type of 80-hour work week. Now, the Bell Commission, I was in New York City, so the Bell Commission happened actually right. They tried to implement it, I should say, it right in the middle of my residency. So I had the privilege of not having the protection as a first and second year. And then in New York City at Columbia, where they quote unquote made it 80 hours, they
That's
tried
yeah,
to
same.
protect
That
the
yeah.
interns a little bit, right? But then when I was like a senior resident, when you're PGY3 and up, it's laughable if you're asking to leave, even if you're literally can't stand. It's you would never. People have to understand that you would never do that. I mean, it is. So you talk about bleeding. That's bleeding. The sharks will
Yeah.
be coming after you. Even asked to tap out or do anything like that. And to be honest with you, there was no one was talking about like what our how we were feeling about it. Were we able to tolerate the stress and stuff? I mean, you know, God bless Columbia University. Amazing, amazing. I mean, standing on the shoulders of giants kind of a thing for me. However, there are things that I'm sure are done way, way better now than were done back when I trained. One thing I just
Absolutely.
want to say on this topic that you hit on that was spot on, that you said earlier. On the one hand, we can share these stories and we're like, oh my God, when we were kids, we walked through the snow 30 mile, all that stuff, right? However, it was putting us through those types of tests that allows us then to be the captain of the ship. And when things go wrong, which is really where you need your neurosurgeon, you need Dr. Grunch to be at her very best. It's not when things are going great and we're all listening to music in the OR and everything's perfect. It's the easy case, it's a very straightforward thing and everything's going great. It's when everything is going wrong, right? That's
Hmm.
when you need to quiet room, quiet your brain, and just do your checklists, go through your protocols, and then sometimes even think outside the box, right? Especially for you guys when you're in the brain, sometimes you just got to go where no one's ever gone before, because that's the only solution. There is no other solution. You've come to the realization, the way we've done it before, everything I've learned, throw that out the window. I have to invent something new right now. But anyway, it's that test. All the time we've been tested, both physically and mentally in our training. And then everything, we've learned up to this point in training that makes us capable of withstanding these crazy call weekends that you're taking right now, when patients are literally looking at you to save their life.
Yeah, that's right. That's right.
So I think that was a great discussion. I wasn't even planning to go down the road of,
I think
how
we
much.
trained about the same time. You probably started what, 2013-ish?
No, I started in my practice 2007.
Oh, okay, wow. Yeah, because
2000,
I
yeah.
trained oh, no, you're right. I started yes. No, I started my residency 2007, graduated in 2013. Because when I first started, we had no work week, but then kind of mid-training is when they were trying to, quote, "enforce it," which was, like you said, you couldn't if you complained, you were done. You were the bleeding minnow.
Oh my God, I honestly don't think I ever complained once when I was, because I just was too
No.
afraid. You're just too afraid, no matter how bad it got. I mean, there are times. I mean, I listen. You find residents sleeping in the elevator, for God's sake. right?
Yeah.
I mean, it's people do not have an understanding unless they've gone through it or they're married to one about, what it's like. And not to mention the fact that when you're a resident, half the time, every other medical provider, right, is kind of almost telling you what to do. Like everyone's criticizing you or giving you a hard time. It's just so much. But you know what? We're better for it. We'll leave it at
That's
that.
right.
And listen, you're smiling, you're happy, you're on social media, you've got 2 million followers. I mean, for God's sake, it worked, right?
Yeah,
Whatever you did,
something.
whatever you did worked. So speaking of social media, which I really want to get back to. So one of the things I'll start. One of my biggest concerns is how difficult it is for people to get what I would call unbiased information from people that are actually experts at what they're talking about. Now, kudos to people that go out there and do some reading and make themselves kind of what we'll call quasi experts. That's great. We need those people. I want people to be as educated as they can. I think that that's great. However, in cutting through a tremendous amount of information, which is growing on a daily basis, I'm very concerned that I'm not seeing enough experts like yourself out there really educating both like people like me, the public, and everybody else in a non-biased way. Like I love your series about, okay, these are the instruments we use. Okay, there's this, and this is the way we treat it. Here are the options, as opposed to getting it from people that just are late to the game. I mean, they started 6 months ago learning about, whatever condition is, and now they're out there and they have so many followers and people are following them for their, advice. So my question to you as we start down the social media path is, how critical do you think it is for experts, okay, especially physician experts, to be out there preaching non-biased messages and helping people cut through the noise?
I mean, it's to put ourselves out there to give unbiased information because, like you said, there is so much information that's put out there by people that aren't even have no healthcare background at all, and then just go and either just talk their thoughts, which can be totally incorrect, not evidence based, or people that just go up and do some minor Google searching and decide that they're the expert, which all patients do it, but in terms of where we get our information from is truly so important. And I find it I mean, you probably do the same. Every time I'm in clinic, I'll have somebody that's just so misinformed about our body that it's shocking, like how little people that aren't in healthcare know about our bodies and what and go wrong or what you can do to help yourself. And we all go to our phones, to the internet nowadays to get that information. And I think the problem with healthcare workers, physicians putting themselves out there is a multitude of barriers that I know that we're going to talk about today. But we're tired. At the end of the day, when we're done seeing patients, the last thing we want to do is talk about our job in front of our phone and then get judged for it because it's just, that's not what most people want to do, but that's what we have to be able to get rid of the noise, get rid of the misinformation, to put good stuff out there. And you have to enjoy it and you have to really be passionate about it to grow on these types of platforms to get your message out. Because when you start, I mean, you're gonna put a good video out, put good content out. I mean, you get couple hundred views, and you have to consistently do that with little to no reward. Is for most people just the time where they just tap out. Like, why am I doing this? So yeah, excuse me.
So I think, one of the great
Sorry.
answer. One of the things that you there, which is one of the reasons that I could not be more passionate and fired up about, doing the podcast and being on social now, is the fact that the level of misunderstanding of the general public that has not educated themselves. It's, from a physician. And again, I'm not talking at, like, oh, like we have much and I can't believe these people don't know. I mean, just from a purely, just a humanistic standpoint, I am beyond shocked at how little people know about basics: diet, nutrition, things they can do, what their options are, what can go wrong, as you said before. I mean, when I talk about that all the time, like no clue. So I spend a lot of my time talking about this with patients in the office, and I want to get this information out. And that's why I've made, like, personally, like you, I want to make that type of commitment to people, that anybody that'll follow me or, watch the content that I put out, in addition to my patients that I see, like, on a personal level, to educate them as much as I can, because cutting through the noise of all the messaging they get from big food, big pharma, insurance companies, on and all influencers out there that may or may not, be biased. Okay, they're not all biased. There is some unbiased stuff, but it's, to be honest with you, it's hard for me to cut, through this stuff. So, thanks for bringing that up. I think that's so important for our audience to understand, is that what we're trying to do as physicians is put out unbiased information where we're cutting through. We're reading the papers, we're reading the articles, and we're saying, you know what, this isn't very factually based, or wow, this randomized controlled study out of wherever it's really earth shattering. It's something that everyone needs to, perk up and say, wow, is this a potential treatment for X
Yeah.
condition? So I think that's great. Now, you hit on barriers. What do you think are the big barriers? You mentioned fatigue and just kind of, worry. Do you feel like one of the barriers might be that it's the judgment part of it, where people feel like either they're going to be thought of as, like, being gimmicky, like physicians, like, oh, I'm not a serious person, or do you feel like they just are worried about just being judged by their own colleagues and feeling, kind of less than they.
All those points is that this, physicians starting on social media, you're going to get judged by your colleagues. You're going to be cringe, if that's the word, you're
Yes,
supposed
that's
to
what
use
I'm
these
getting at.
days. I mean, it's true. I mean, and I face the same thing. Like, why are you doing that? I mean, that's not that as a physician you should do. That's not professional, which is the biggest
Correct.
thing. It is. I mean, like, the bottom line is social media is here to stay. This is where us as physicians go to entertain ourselves, to watch, get information too. I mean, it's and if we don't go there, other people will, and other people are. So I think it's being judged by your colleagues, being judged by your patients, being feared of being not known as being factual, being judgment of ourselves, and, like, are we putting the right information out there, which
Right.
is an astute to our healthcare training, and the toxicity and the internal judgment, um, and the bias that we put towards ourselves to think that we're not good enough to be there. And it's just a lot. And there's much negativity on social media, and I tell people this all the time. Like, I went through neurosurgery residency at Duke, and yet I sometimes feel like putting myself out there on social media. I get so much negative feedback, not so much, but enough negative feedback to where it's harsh, man. Some days I wake up, I'm like, I don't know why I'm doing this. I don't need to do this. I don't need this in my life. And yeah, I think it's all the above that just prevents people from wanting to do it. And then there's the time component. Like, you do this day in and day out, and when you're done with work, you want to spend time out with your family, and just the pure commitment, and and the grow is the boundaries why people like us aren't doing it.
Yeah, I mean, that's an answer. And I think people should see it like this. Okay. Us as kind of experts in as physicians, and what we want to talk about, we have had the training and the background to be able to really understand what's out there and try to cut through some of the noise and be very honest about what the level of evidence is on the stuff. Like, I always talk about, yeah, this is early and it's, this is more experimental but exciting, or, this is something people, should consider. But just to give you an example, the other day I was going to post something, and it was kind of vibrational medicine and some of the things that are coming out. And it's interesting because I'll never post anything without doing really hardcore research on it, because after all, it's my reputation. I know you would never do that. I've watched all your stuff and you always just tell it like it is. And so after doing the background research on it and really trying to see if this was above board, I just didn't feel like it was above board. And I actually had I was like, wow, this is a great post. People are going to love this. Amazing. And once I did that research, because I always do this extra background research before I say anything, I nixed it, and I'm very happy I did, because it's just not true. It's just too much of a gray area where I just don't want to go there, because people are looking at us, as experts. And although we're not giving medical advice with our things, we are spreading, information that then is going to be spread, on and on. I mean, with your 2 million followers, when you go on TikTok, if you say something in the medical field and you were to say something that was not accurate, guess what? Your 2 million followers are all going to see that. And you know how it is. It's an exponential thing.
Mhm.
And 2 million could turn into 8 million people, then think that, whatever, elderberry will cure their brain tumor. I'm
Oh
just
yeah.
throwing something out there. People say
It's
crazy stuff, crazy. And we
uh,
wouldn't do that and do, you can help me actually. I'm going to answer a question. Like, how do we really gain people's trust? And you've done that. How do we gain people's trust so much so that before they go to other resources, they're going to come to, for example, your channel and say, let's see what Dr. Grunch thinks about this, or ask a question, to send you a message and say, hey, I read this article. What do you think about it? And then maybe you can do, reply. How do we gain, how have you been able to trust? Because I see the responses that you get on social media, and man, you've got some loyal followers that, like, they hang on every word that you say. That's a lot of pressure, by the way. I'm sorry. It's just a
it
lot of pressure.
is.
But how have you gained the trust?
I think it's just my consistent posting on topics within my field. And one thing that I think a lot of healthcare influencers really they they don't understand is they need to stay in their lane. Like, yes, I can talk on medicine, but I don't go in and educate on colonoscopy screenings
Yes.
or lung cancer. And there's so many healthcare influencers that do that. They're a physician, they're an MD, or I've even seen podiatrists, or not, no shade, but they need to, I never want to talk about something that I don't know about. And I do not know about anything out in my field for the most part. And so I really just stick to topics that are within my field of specialty. So I know I can talk really deep about it and on a level in which I am confident that I know those
Love it.
answers to. And if I start diving out and talking about other topics in healthcare that really aren't relevant to me, I'm not going to be seen as that expert. So I try to really focus in on brain and spine, and anything relevant that may affect the brain and spine. And yeah, just the posting is really. I think it's also really important. I talk about one. I have Sunday case study, so I talk about one particular topic
Mm.
every single week. So that helps me, for myself. I was doing that for nobody else other than me, to gauge my consistency on education. But it's one of my mainstays of my platform. And so to force me to really dive deep into a topic is to do it every single week. Um, and that's helped me kind of become the expert. And then if anything comes up in the news or something happens on Monday Night Football related to that, I jump on. I've woken up at 1
Yes.
in the morning and talk about Tua's injury. You just have to, like, be relevant and do it consistently to that trust, and to be, to do it well. Like, you know what I'm saying? Like, just, you can't be saying stuff that's off the engine. And I have been total, victim of posting stuff that's maybe not the best, and I've gone through and I'm like, oh, I didn't see it that way when I initially posted it, so I'm gonna have to take it down, or I need to, like, let's
Yes.
revisit that topic and just speak about it. And you have to be true to yourself. So I try to go through everything I post and look at it from all ends of the spectrum. And sometimes if I'm like, I don't know, I'm having second thoughts, I'll send it out to, my friend, my social media manager, my PAs, and be like, what do you guys think about this? Did I say that? Am I going to sound like a complete moron? And then I sometimes post it, and I still do. And I'm like, shoot, and let me take that down. I mean, it is what it is. But yeah, I think those are all factors in which you can slowly become an expert. And you have to be likable. You have to be
Mhm.
very open-minded. You can't be someone that's so direct that no one wants to challenge you and then you eat them alive because you're also going to lose people's trust by just being a very, closed-minded person. So it's a lot. It's a lot to digest.
I can't agree, I agree with you more on everything you said. And I think that, again, just to reiterate what I said before, and you just hit right on it again, and that is when you um, are posting stuff, we are so much more self-conscious about what we're putting out there because honestly, all those sleepless nights at Duke and for me at Columbia, I mean, I don't
Mhm.
want to throw that away because I post out some nonsense and next thing you know, like I'm, like the idiot doctor that literally is making stuff up. Really, I mean, honestly, it's funny. I just all the time, and I do a lot of kind of work individually with physicians to try to kind of help them. And we always talk about like it takes a lifetime to build a reputation, and literally 1 minute, one stupidity, right? One wrong thing to completely entire reputation and to earn that back. Oh my God, it's so hard to do. So there's a message I do want to get out to our audience is that our commitment is that we are not going to put stuff out there that is nonsense or is whatever, or
Mhm.
that we are, being paid to do, or, just, I would never do that. And they have to trust us. Obviously, they don't know. I mean, they don't know what you do in your personal life or who you commit. Me too. However, over time, the consistent posting, the consistent messaging, and then vetting us for that is going to be phenomenal because then they understand how serious we are about it and how we do it. The other thing I wanted to talk about briefly is I agree with you about physicians really staying in your lane. When I started, I was talking more about spine surgery, but I didn't even say a word. I mean, the only reason now that I am so deep into this wellness rabbit hole is I've literally spent the last 2 years, and I post sometimes all the books I'm reading. I mean, I've read entire textbooks on concussion, red light therapy, traumatic braining, all this different, all these necessarily, in my field, and especially like obesity. I'm very passionate about obesity medicine, but I didn't just start talking about it like off the cuff because I read one article. This is after
Right.
talking to a lot of experts and actually sitting down and reading the textbooks. The last 2 years for me personally have been almost like I'm back in school because I've gone back to the basic science. And like, for example, one of the things I talk about a lot are mitochondrial dysfunctions, which are so important in brain diseases, actually, but in almost all diseases. And so I've gone and made myself a semi-expert in mitochondrial function. And it's stuff that I did learn about a lot in my basic science years, but I had to, freshen up. So I didn't start talking about it until I became like this maniac that spends, you know, hours reading about mitochondrial function a week, which some people find strange, but I love it because people don't get it. And I like teaching about health and wellness now just because I see how sick my patients are, how many medications they're on, and how, man, they're steered in the wrong direction. It's insane how badly steered in the right direction. I do want to get a little bit into kind of how patients, some advice for patients, looking. How have you been able to so nicely, and this is advice also for people that want to get on social or uncomfortable, how
Mhm.
have you so nicely been able to take extraordinarily complex topics and explain them in a way that is so digestible where the average person can learn it, but they're actually learning really good information? You're not just saying like random stuff just so they know what the word spondylolisthesis means. Like
Mhm.
if they watch your videos, they'll know what spondylolisthesis is and what the treatments are. How are you walking that between doctor speak and then
Yeah.
just speaking to a fourth grader? How do you get between like to the average Joe out there, Joe or Jill, that's looking to
Yeah.
learn more about these.
I mean, excuse me. Um, so when I started social and started my education process, I really was dedicated to putting information out there for my patients. So, I think a lot of us get caught up in healthcare about when we're talking on social platforms and even LinkedIn, we're talking to our colleagues and in some ways we are, but the large majority of the audience that's on socials are not physicians. Even like if you have a podiatrist speaking podiatry talk to me, I don't know what they're talking about either. So essentially when I'm talking at such a high level, I can probably only get out there to other spine surgeons or other really high level specialists. And so that's not really the audience that we're engaging to. So I think you need to learn your audience and who you're speaking to. And so when I put educational stuff out there, I pretend like I'm talking to my patients.
Mhm.
Every day, and I'm breaking down diagnosis, I try to get better at making it digestible for somebody that really has like a high school education so they can make their healthcare decisions, because that's what we do in our practice. I'm explaining someone why they need me to operate on their back. They need to be educated. And some of them are like, "Doc, I don't care. You do what you want." But I don't want them to do what I want. I want them to understand what I'm doing to them so they can be an informed patient. And so when I'm breaking down topics, that's what I do. I want anybody out there to really, anyone from high functioning, high level of comprehension of the topic to the lowest level of comprehension to understand everything what I'm saying. And I've gotten better at it as I've grown over the past few years. And I think, that level of ability to really break it down, everybody has that. You just kind of have to find what works and the terms that you use and it's fun for me. I really enjoy that. I don't know, you're the same way. I've learned so much by
Mhm.
being trying to educate myself on these
Yes.
topics. If I didn't do social, I would not even know about some of the topics that I've talked about because I have to go and do my own research or, these rare diseases that I've never really seen in practice,
Mhm.
but I've talked about it. I've recognized now as a doctor some conditions I'd have even thought about because
Yes.
I did a post on it, and it's really kind of it's just kind of fun because it's helping me learn and grow, which is awesome.
No, I think that I love that, and I second that times a million because I've gone, 2 years ago, I would have never thought, like I said, I would be studying all these things, and it's just made me. I mean, I'm a student again, and I love it. That's why I love the podcast and talking to docs like yourself. Where I mean, I learn so much from these conversations, and I learn a lot from self study, and then putting out posts, but not just putting out posts where we put a lot of thought into it, into making it a way coherent, because sometimes our first versions of our posts, they don't even make sense. People are not going to understand what we're saying, or it's too doctor speak, like you
Right.
kind of said. And it's funny on that note, I want to say what I've termed it as, kind of speaking to physicians. I call it spine LinkedIn, right? And so every once in a while, I'll throw a post out there on how I did like an AP fusion or something like that and reduced a really, like a grade 2 or grade 3 spondy or something. And that's for kind of spine LinkedIn. That's a whole different consortium. And they kind of hang together, and do that stuff and show all their cases. And everybody, looks at it and says, wow, look at the alignment. That's great. Oh, why didn't you go to T4? All that stuff. That's not the audience that we're trying to really a generalized, fraction of the a faction of the population, where those are the people that really need the education. I mean, I'm not going
Mhm.
to, I mean, me sitting out here trying to educate, I mean, that's just not what I want to do, because millions of people are completely misinformed basically about everything, because they're right. We're in just these toxic environments with misinformation and all these things coming out at 100 miles an hour. That's why I like like we are moving at the speed of light, like my podcast name. I mean, we're going so fast. Sometimes we don't even know what we're doing. We need to take, a step back, from there. One of the things that about, and I want to ask you what you kind of, how you found your career of seeing patients is, Patients come to you, right? They have a brain tumor, they have a spondylolisthesis, they have a scoliosis, whatever. They have a spinal cord tumor. Kind of enamored as I am into how sick our patient populations are. And when I say sick, I mean physically and mentally unwell. That almost makes you think, hey, I get it that you're here for your sciatica, but we've got a lot of other things to really, do with you. How do you handle that in your kind of patient visits? Are you taking some of that on yourself, like I've decided to do recently, or do you just use a big, group of other kind of specialties that you collaborate with to really the patient from a more holistic standpoint? Because you know what, if me fixing somebody's sciatica when they're severely depressed, morbidly obese, diabetic, on 100 medications, that's not going to fix their life. Yeah, their leg pain's better, but gosh, I'm a physician. We're supposed to be healers. Like, how do you handle those people?
Yeah, those are so important topics, especially in spine care, because you have people that undergo surgery and they don't get better, and it's not because you didn't do a good job, it's because the underlying issue wasn't really what you thought. And pain is so subjective. Not everybody that has a grade 3 spondylolisthesis and severe stenosis, they're walking around like no pain at all. And then you have someone with a tiny little annular tear that's in debilitating pain. So me judging someone on their imaging and the quantity of pain that they have it can't be done, because you just listen to your patients, and some of that pain may not be pathological. And it's our job as healers, like you said, to make that decision on which are going to get better from surgery and which patients aren't. And that goes from mental health to physical health to social health. And if we don't judge all of those topics and educate our patients on this, on how they can better themselves, no one will. So I used to earlier in practice, and sounds like you're the same, like rely on, okay, well, um let's go talk to your primary care doctor about your diabetes. And then I would get so like nervous that the patients are going to judge me if I even broach talking about their weight, or if I talked about their mental health. Like, I didn't want them to think that I thought they were crazy or that they're too fat, which can easily be the message they hear if you don't deliver it right. And then, they'll get out there and tell everybody, oh, Dr. Grunge said it's too fat, or whatever. So, or she thinks I'm crazy because I should never be in this pain because my MRI looks great. So yeah, I mean, I think it's been helpful for me to really have a broad workforce of my that can help me with these topics, because if I send them out there, they're either not going to make the appointment I recommended, or the people that I send them to aren't going to help them. And it just got so frustrating for me to have this cycle of, you need to go talk to weight management, and then them tell them to drink a shake. That's
Yes.
not going to work.
No.
So yeah, so to answer your question, I decided to take it on. I've educated myself on ways to better tell patients and deliver that message, and even messages that I can relate to them to help them treat it. Because if I think they're obese and I don't give them solutions, I'm not helping them. So I think, to your point, learning about general wellness and how I can educate them on making better diet choices, on, weight loss tips and suggestions. Their back hurts, they can't go exercise, but you need to understand that 80% of your weight is your nutrition. It's not the fact that you're not getting out there and running 5 miles a day. So yeah, I mean, I think all to be a good there's good surgeons, and then there's physicians. And I think to be a good surgeon, you have to take into consideration and really make smart decisions so you can have good outcomes and your patients have good outcomes. So yeah.
Yeah, I think you know what? There's so much to unpack. It's an entire other. We could do an entire podcast just on the perception of pain,
Yep.
and that is something that I've really, I mean, taken on. I mean, again, I'm an ortho spine guy. I've got neurology textbooks all over my office, obsessed with this stuff because the perception of pain, right? And then, like pleasure reward centers in addiction and opioid use. in a lot of the patients we see is crazy. I've educated, myself on that, tremendous. That's why I had this Kenneth Bloom on, this world famous pharmacologist who just talked to pleasure reward center and the fact that if you different alleles, you're more susceptible. Just stuff that I never had heard of ever before I started diving down these pathways. And same thing with you brought up the concept of talking about their obesity and this concept of fat shaming. We have to get that out of our minds. We literally, this is what we have to help the people. And I'm frustrated because the providers that are seeing them are not helping them with their weight. Telling them to eat a half a sandwich instead of a full sandwich for their portion size, that is not advice. That's nothing. Or like you said, just do the shake or do whatever. So in my practice, I try to educate on things like intermittent fasting or paleo diets. And I actually give my patients some resources to go. I'm in love with this book. I don't know if you're familiar with it, but anyway, it's called The Obesity Code by Jason
Oh,
Fung. And I tell them,
love the
oh,
obesity
love
code.
it. Yes. And you know what? If you, Jason, I'm looking for him to come on the show, his brain about this, because it's one of my favorite books. It really opened my eyes to what is possible and reversing type 2 diabetes and all this amazing stuff that's out there. And the patients that have to, and it's interesting, patients that now I talk to almost every OIC, they are so open and ready to learn about their obesity and to take tips and other things that we can give them. And a lot of the patients, they literally sit there and order the obesity code on their phone on Amazon while they're sitting with me, and they're so excited. And I say, well, you've been in the healthcare system for decades. What kind of diets have you been put on, whatever? And the answer is usually nothing.
Yeah.
That's not good.
Yeah.
It's a good thing. So I love the fact, and I kind of knew that about you, Jim, from following you on social, that you were very into like looking at the patient's overall kind of health and wellness and putting them down the right track. One of the things I just posted about the other day, I just did this little video. I was actually in Florida, just off the cuff, but I talk about it all the time. And I'm sure you could really speak to this because you see it every day. I don't know if I coined this term or if it exists. I looked it up. I don't know if I coined it, but it's something I call starting bias. And I think that patients out there, as we educate, especially on social media and really they have to understand their course of care is going to be so different in where they start in the medical system. So what we always talk about is like something that, near and dear to you is if you have a sciatica, right? How different is their care going to be whether they start in the emergency room with a neurologist, with a naturopathic doctor, with a physical therapist, with a chiropractor's office, in one of our clinics, in a pain management clinic, okay? Can you speak to our audience as to how important it is for them to understand how different we all think as specialties and how patients really have to be careful about being funneled into silos based on where they start in the healthcare system? Because oftentimes, if they just take whatever advice they get, they go down one path, and that's where they're going to go. And they might not realize it's not working for 6 months before they realize, oh, that was the wrong choice. So can you speak
Yeah.
to that starting bias a little bit and what your thoughts are?
Yeah, I think it goes down to education and patients, getting the right realm of care for whatever problem they're having. And those patients that advocate for themselves and educate themselves on who they should be seeing are going to be the ones that have the best outcomes, because you're right. You can get into this rabbit hole, if you will, of seeing, like, particularly people, there's chiropractic medicine, and I don't want to feel like I'm dissing chiropractic medicine, because I definitely feel like it has a role in our healthcare system. But I'll see patients that are spinning around with their chronic lower back pain and sciatica for years, and they have
Mm,
this large disc herniation at 5'1" that I could have fixed 5 years ago, and they would have been out of pain. But they've been pouring in their own money into adjustments and wellness that they've been educated on, and not really going to see a physical therapist, or not trying an epidural injection, or just the basic things where if they would have started in the healthcare system in the right direction, they would have gotten much better advice to get them to the end point and in a better spot. And then I won't even talk about where that chronic pain may lead them socially or mentally or lose their job or it's just it's such an important topic, and I think it ultimately goes back to education of the public to where they need to go if they have certain symptoms. So
Yeah, and I love it. And again, all those places where you don't want to go right now, it's an entire episode. It's an entire other, podcast that
yeah,
we could do together because there are just so many different rabbit holes that people can get into. I think that one of the things that's important is definitely the education piece, which you said beautifully. But the other part is what I recommend to my patients is always look for kind of a couple different pathways. So different people that think differently, right? It's like we do as physicians, right? Like if you have a really complicated case, how nice is it to have a couple different colleagues that think totally different? Because you know that Dr. X is going to be maybe more, oh my God, let's do this, this huge procedure. And Dr. Y is going to be like, hey, why don't we just watch this and do whatever? But it's good to help to have different thought processes and sometimes seeing the same, like seeing maybe two pain management specialists, you're maybe not going to get a ton of difference. You're going to get some because like what we say, spine surgeons, right? 10 spine surgeons, 20 opinions, right? Because we even change our own
yes.
minds before we say stuff. But I always suggest, so for many of my, people that are struggling, not just with spine stuff, but with other things where I don't have a surgical solution for them, I say, you know what, instead of seeking care where you're seeking, why don't we get you over to more holistic minded providers? Or you really need to get into the mental health, like look at it more from a mental health standpoint. And again, I'm not judging them saying that, there's something wrong with, that. I'm like, listen, there's plenty of doctors that need all kinds of mental health, you know, help. So it's not that, but just doing like other specialties to kind of go down those routes. I think that's very helpful to have that in somebody that totally different, to then come up with different types of solutions where patients can really understand, and then also them educating themselves by following people like you, where they can know more about their spine health, and kind of had to kind of go down those routes.
Mhm.
So one of the things that I want to ask you as we kind of try to wrap it all together, and this has been wonderful, kind of learning more about the social media and things like that. I got to ask you, what is your favorite all time social media post? Whether it's one that went crazy viral or one that didn't go viral and you're still angry because it didn't go viral. You're like, how in the world did everybody in the world not see that particular post?
Yeah, I don't know if I have a favorite. I love so many, but the ones I think just general, there's two types of posts that I do that I always find to be really fun and fascinating is one, my vlogs, because my day in the life posts,
Yeah, yeah.
because no one really, and for me it's like what I do every day, day in and day out, and I put it out there, and and I just, people are, wow, I can't believe you do all that in one day or whatever. And for me, it's just normal. So I'm always just kind of, I just think it's fun to give someone a glimpse in the life of what we do, because it is kind of such a, we have so many about what we think surgeons or doctors do. Like, doctor loads a dishwasher. What? Like, yeah, who's going to load my dishwasher for me? Or who's going to fold my
That's
clothes or put my kids to
awesome.
bed? Of course I do that. And then the other post that I love is just the transition posts where you're the girls, or I'll say girls, guys do it too, but on TikTok they'll do in one outfit and then transition to another outfit. It's usually something where they're showing half their boobs or whatever, but I love doing that, and then scrubbing into surgery, because I just think it's such a powerful post, and those are the messages that we need our kids to get out there. Like, not everybody, you can be something, anything that you want to be based on your kind of perception bias of what you think someone looks like in regular clothes and then what they do for a living. So I really think that those kind of concepts of empowering our youth is important and powerful, and it's one of my favorites. A little cringy, I know, but it's fine.
No, you did that was awesome. People love that. Obviously, that was amazing. I mean, listen. It's so funny when I first saw your posts. I went right to my wife and I said, "This doctor is. I love everything. It's exactly what we need to be as physicians, because people need to understand who we are, how we think. And when they understand that we're just like them, we get excited about tattoos, or we get excited about, our favorite sports team, or loading. I don't know if you get excited about loading the dishwasher, probably not, but you get what you get what I
We
do. Maybe that's I certainly don't get excited
no,
about loading
no.
the dishwasher. I got to be honest, but them seeing that side of us and being that our genuine selves, right, and not being, I don't know, hoity-toity, or whatever your
It's
favorite,
true.
words that we can be, and ourselves. Because I know, listen, I've never sat with you in a patient visit, but I already know, just from us talking and having communicated, that you're kind of like me. It's a very relaxed. I'm just like, I'm a human. I have all these tools. Hey, I've spent the last 25 years learning about this stuff, and this is how we can help you best. I'm not like, well, the studies show that 96 that stuff is not relatable. So your relatability that you're showing on social is something I'm trying to emulate. I'm just being myself. And so
Yeah.
even when it's a little bit weird, sometimes I'll put out posts and I'm like, man, I don't know. I'm just like, I feel weird. I don't, it's like, I'm so me. And like, I don't know if people are going to accept me for just being this very casual, guy that is supposed to be their surgeon doing, T2 to the pelvis for their deformity. But it works, and it definitely worked for you. Like I said, I went right to my wife. I'm like, okay, I'm fired up now. I'm doing whatever Betsy's doing. I'm doing
Well,
that.
that's the easy thing about being authentic and being yourself, is that the content flows naturally. So for me, like my kids, I took my son out to eat yesterday. I posted about it. Like, me being myself is allowing me to be consistent, because I don't have to force myself to be someone I'm not. So I talk to, I'll post about my kids, I'll about some stupid dance I want to do, or I'll talk about T10 to the pelvis and pros and cons of taking GLP-1 medications and improving your health and whatever. But everything I post about, I feel like, is just so in tune to who I am. And so, if cringy or not, I mean, there's some stuff I put out there and people hate, and I'm like, you know what? That's part of me. I accept it. That's who I am. If you don't like it, if you don't like tattoos, if you don't like whatever cars, you think that that's okay. I mean, you, and I'm not for everybody. And that's, I think, what we have done as people. When you put yourself out there, not 100% of people are going to
Yes.
love you. And you just have to accept the negativity, because I don't want that. I don't want them to, if they don't like me. And I understand that not everybody's going to like me. Not every neurosurgeon is going to think what I'm putting out there is positive or professional. And that's on them. I mean, I'm just doing me, and that makes me relatable to my followers, but most importantly, makes me relatable to my patients. So when they come in, there's so many patients that see me, that trust me and wholeheartedly, and I've never spoken one word to them, but they come in there and they are 100% confident that I am going to fix them. And it's all because they this online trust that they follow in me. And I've had patients fly in from all over the country and even other countries. And it's wild to me. I mean, I'm truly honored, but I always start from ground zero to talk to them, because I can't, it's mind blowing how much has in you. And I think using a free platform like social media as a physician to do that for your practice is is so easy to do. And you just got to get over that why am I not doing it, or why are you not posting that what you wanted to post. There's Just do it. Who cares what other people think about you? And that's my best advice, is let the perceptions of what you think people are going to think about you, and just realize that not everyone is going to love you, and that's okay.
Yeah. You know what? That's amazing. I think there's just this little this thing that you said. I mean, people are going to love that. We do our shorts. It's
Oh,
just this little clip, because honestly, that all sums it up. One of my favorite all-time sayings, Les Brown, he's this motivational speaker. He's since passed, but what I love is other people's opinions of you are none of your business. And that's basically what you just said. And I've the truth is I've always thought that anyway. Now obviously we want people, we have to be on the up and up. We're very, I mean, we have to be concerned about what colleagues think about our work, right? You don't want your colleagues to see, all your patients coming back with all these issues. That is a completely different thing. That kind of stuff, we are all like type A obsessed, what our look like, the fact, having low complications, all that. That's not the topic of this discussion. It's the personal stuff. It's when we want to get ourselves out, or we want to talk about our opinions about healthcare and stuff like that. Who cares? Other people, we want to get out there to people that are going to support us and be positive. And I always talk about positive vibrational energy and how much it's so nice. Like having this conversation with you really completely fires me up because we're just a couple of, you're a neurosurgeon, I'm an ortho spine surgeon, but we're just a couple of spine surgeons just shooting the breeze talking about social media. I mean, who would have thought, like 2 years ago, I would have never thought I was going to be doing this. This is like, it's
Yeah.
not even, it wasn't, there was no genesis, there was no inception, there was nothing going on. But having these discussions allows your patients, my patients, people out there, social people that want to watch, this podcast to just say, oh my God, they talk like I just typed this morning on that Zoom call. Like there's no difference. It's the same. We're not here saying, hey, let's compare our statistics and like go through all these charts and stuff. That's all that stuff is great. Don't have to be forced just to talk about those kinds of things and statistics and things just because people think that that's what we should be talking about. I think you should be talking about love and tattoos and all this other stuff. And for me, my big, passion is I'm just like wellness geek. And I just love talking about all this wellness stuff. I mean, I can't get enough of. To me, like the population is so sick in the richest world. And you know what? We train for this stuff. We've got to be part of this solution. Otherwise, honestly, as physicians, we're part of the problem. If we're,
Yeah.
if we're just all we're doing, writing prescriptions and doing procedures, that's not helping anybody, to get to the next level. So I absolutely love, that answer, certainly that you gave. I mean, just fired up. If there's something that you could get out to other physicians that are on the bubble, they just can't get themselves, they have so much to say. They're very, you know what, when their family comes over, their family walks away because they won't stop talking about whatever they're passionate about, in the medical field. Okay. How do we get these people? Honestly, I'm passionate about getting my colleagues out there and actually tell
Hmm.
my partners, hey, why are you not on social? You say like sometimes I quote my partners when I do
Yep.
social media posts because they say these brilliant stuff. I'm like, why am I saying your stuff? It's your stuff. Go out there and take credit for it. How do we get them off of the fence? Because we need them. Patients
Yes.
need them. People need them. We have to educate. We have to be out there doing this stuff. What would be your pitch if you were on Shark Tank? Speaking of swimming with the sharks, right?
Yes, yes. So my recommendations is be and be you. So as long as you have those 3 points, like we all have our passions. We're all passionate about so many different things. And we're passionate about our field of choice. I mean, that's what we do as a profession. So as long as you understand that that passion will convey to your listeners, just do it. Just take the step out, realize that not everyone is going to embrace you. Just like not every patient is going to want you to be their physician. We accept that, it's tough. And if someone chooses a surgeon and not me, I get feelings hurt sometimes.
me, me and you both.
Yeah.
That's
So
well, we're human.
yeah, I mean, we have to understand that not everyone's going to love us, but a lot of people do, and you just embrace those that love you and trust you and want to listen to what you have to say, and the rest is, and the rest will happen. So I think that just that initial step over realizing that that's reality, and we'll get them through because you're right. We do need more people out there spreading good information to everybody, to the public. and to social media, just so can all be well informed.
And in this day and age where honestly we are all being commoditized, because even as us ourselves, we sometimes need healthcare ourselves or wellness or whatever. And so we walk around with these little dollar signs over our head as we walk around, and everyone's looking at us in a $4.4 trillion system. How can I get, something out of person or that person? So I think what you said was awesome as far as educating oneself in what the options are, doing online research on the particular physician. Actually, one of the things we didn't talk about is how patients can actually reach out to people that are around us to figure out if we as physicians are the right people to go to. So not only social, but they can also,
Mhm.
call, nurses that know us, things like that. That's a whole, again, a whole other episode. But that being said, I think that being an educated consumer in today's environment could not be more vital and critical in today's age for people to make sure, like you said before, don't end up that the person that was a professional and walks into your office 2 years later having lost their job, being on all kinds of opiates, having a chronic pain syndrome, having who knows what done to them, and now they're like, hey, Dr. Grunch, can you fix my spondylolisthesis pain? And you're just like, oh my God. Like, I needed you, 18 months ago, not now. I mean, it's a mess, and we deal with that kind of stuff all the time. So I think what you said was getting into the right place, and that's going to be a lot of consumer education. So thank you so much for the great. In conclusion, I think this is really important. How can people find you if they, after watching this, I know that they're going to say, oh my God, I have to, I have to follow this doctor. She's so down to earth and, she's brilliant, all this other stuff. But what are the best ways to contact you if you could just, let us know that. And obviously we'll to the public so they can directly.
Yeah, I am on most social media platforms, YouTube, Instagram, Facebook, TikTok. Lady Spine Doc is my brand or name on all the platforms, and LinkedIn is Betsy Grunch MD. So I have my practice website is drgrunch.com, and yeah, you can find me in all those places.
Oh, I'm so of coming, for you. You've had an amazing career in neurosurgery, tremendous, background, and how you can overcome things to get to where you are. So kudos for that. I mean, but otherwise, thank you for coming on the program. Thank you for coming on Wellness at the Speed of Light. And until next time, everybody, hopefully you really enjoyed this episode, got a lot out of it. I know I did. And we'll see you all next time on the show.